year now, the country will have a Republican president and a Republican Congress.
One of the first things on the new president's agenda is getting rid of the Affordable Care Act, or Obamacare.
Insurers are leaving, premiums are soaring, doctors are quitting, companies are fleeing. Obamacare has to be replaced, and we will do it, and we will do it very, very quickly. It is a catastrophe.
That was about 3 weeks ago. Candidate Donald Trump last week. Today, Republican leaders in Congress said they were preparing to work with Trump in the new year. KXAN investigator Kevin Schwaller found while the future of the law is in question, people in Texas are still signing up for coverage under the health care law.
Small business owner Jill Ventimiglia runs an Austin spa and is now carefully watching the future of her insurance plan.
I'm actually having surgery a week from today.
Before Obamacare, she says insurance companies would not cover her because of endometriosis, a pre-existing condition. Now, with insurance, she's preparing to have her uterus removed.
And I wonder if I waited till next year, if that would even be a possibility.
A few years ago, we introduced you to Jill's parents. Their insurance plan ended and their offers in the Obamacare marketplace were more than double the cost.
I thought I would come today especially and see what the likelihood of uncertainties or how things may change.
In Austin, nonprofits continued signing up Texans for new coverage under Obamacare.
There are subsidies already committed to for 2017. I think that we will see those issues in 2018, but people have an opportunity to sign up for health insurance now through January 31st.
Only the next 4 years can fully answer the question about what's next for health care.
I'm not happy that I'm spending tons and tons of money on it, but I'm happy to be covered.
Kevin Schwaller, KXAN, investigates.
We also spoke today with senior lecturer at the University of Texas, Dr. Christine Lozier. She doesn't believe Republicans will be able to repeal the whole law, at least for a couple of years. She also believes parts of the health care law will stay in place, like children being allowed to stay on their parents' plans until they turn 26.
It is still unclear what a new healthcare system would look like under President-elect Trump. The campaign's website outlines the first step as the complete repeal of Obamacare and the requirement for you to have health insurance. The plan mentions a focus on health savings accounts and working with states to create high-risk pools, which could be an option for people with pre-existing conditions. Low Shore with UT says those pools would also hike costs for those customers. The campaign website also describes removing barriers to free markets for drug companies to allow you to buy drugs from overseas.